Good afternoon, everybody. This is Emma Smythe with the Michigan Center for Rural Health. Today, I'm pleased to introduce our speaker, Dr. Ken Rosenman, Professor of Medicine, Chief of the Division of Occupational and Environmental Medicine at Michigan State University, who will be speaking on the Michigan AgrAbility program. Dr. Rosenman, go ahead and begin your presentation.
Okay, thank you, Emma. I'm happy to be speaking on this webinar series again. I've previously spoken about medical conditions common to patients in the farming community, including injuries and pesticides exposure. But my presentation today is different. I wanted to make practitioners in rural areas aware of a special benefits program for patients in their practice who farm. And I want to be able to encourage healthcare providers, to encourage their individuals to take advantage of this free program. And I'm also interested in feedback from practitioners on ways we can get the word out both to other practitioners as well as to the farming community that this program is available. So the website for the Michigan AgrAbility program is on this first slide, that fifth line down there, michiganagrability.org. This is a program funded by the United States Department of Agriculture, and the participants include Michigan Easter Seals, the Michigan Extension Service, and the Michigan Farm Bureau. And there's my contact if people have specific questions for me. So let's proceed here. So as I was talking about, this is a benefit program for people in the farming community. It's a resource, just changed on its own, sorry. It's a resource for the agricultural community to enable them to continue to farm safely with a disability or aging condition. And it's a special, there are a set of rehabilitation programs for people who have impairments to help them continue to work. But this is a special program from the United States Department of Agriculture just for the farming community. Why is this special program? And three reasons are listed by the USDA. One is that farmers have a very unique skill set that is not easily replaced. And their homes, their work, their lifestyle are all bundled together. Less than 2% of the population raises the food and fiber that the other 98% depend on. So we actually have a small number of individuals who provide the food we eat. The second reason is even if farmers wanted to change occupations, there's relatively few alternative employments in rural areas. And then if a person has an impairment, they're even less likely to be able to find a job. So a farmer with an impairment who couldn't farm would really be at a disadvantage to find other work. And finally, farmers really like their work. If they become disabled from their job, they want to continue it. And really, this program is all about finding the support they need to adapt so that they can continue to farm. If we look at the demographics of people in the state who are eligible for this program, so at the agricultural workforce, Michigan's a population of approximately 10 million individuals, and so farmers and the farming community is a relative small percentage, but in a rural area, there's going to be a much higher percentage of individuals associated with farms. So we have approximately 80,000 farm operators, and then we have approximately 83,000 individuals who work on farms, and these include regular workers who are full-time employees of the farm, or what's typically called a migrant worker, somebody who may come up here from Texas or Florida and work in the growing season and then go back down. So there we have a total of about 160 3,000 individuals who work on farms in Michigan. Particularly for the farm operators, this is an aging population. Their average age is 56 years, and a quarter of them are greater than 65. And we know that various impairments and chronic medical conditions increase with age. And so this is a population that has, just by the factor of aging, has a number of impairments. Now, people who could potentially benefit from Michigan AgrAbility include people who actually have farm-related injuries. And so based on the estimate of how many farmers we have in Michigan and the injury rate, which is based on national data, we have approximately 2,500 farm workers who are injured each year. And these can be, relatively minor. It could be, let's say, a back strain or, an ankle strain, or it could be severe. And so approximately 5% of these 2,500 injuries a year cause permanent impairment. So that's about 120 people a year. And those are people who would potentially benefit from this program. The much larger group of people who would benefit are people who have, overall disability, chronic conditions, and so if you look at the overall prevalence of disability in Michigan, it's 13–14%, but markedly increases with age. And if a quarter of the population of farmers or farm owners are greater than 65, so there we're talking about 25%. And so if we total this up, there are approximately 2,000 individuals in the farming community who could benefit from this program. And currently the program is servicing 120 individuals a year. So there are clearly a lot more people who potentially could benefit from this program. And this is just a little bit more about people who are disabled in the state. So there's an estimated 684,000 individuals between the age of 21 to 64 who are disabled. And you can see that individuals with various impairments have a much lower percentage of working, so that only 28% of people who are disabled are working versus 73% of individuals without disability. So clearly people who have various impairments are much less likely to work. And as I talked about in the rural setting, in the farming community, that's even going to be worse, where there are not a lot of alternatives for individuals with impairment. So let me give you some history of the AgrAbility program in Michigan. So Easter Seals Michigan, which is a nonprofit charity, and has serviced individuals with impairment and disability for many, many years, began working with the farming community in 1990. They did this on their own. In 2003, they began working with the MSU Extension Service on a similar type process, but with money from the USDA. The Extension Service lost the funding in 2012, but Easter Seals continued to do this, although on a more limited basis. But then in 2014, the MSU Extension Service was successful in getting an award from the United States Department of Agriculture, the USDA, and has been able to expand this service to farmers. So really the service has been going on since 1990, but has been markedly expanded in the years when the USDA has provided funding. So I talked about injuries that can occur in relationship to work, but if you just think about conditions of aging and potential things that can cause disabilities, anything from arthritis to heart disease to visual impairment. So somebody who has some difficulty seeing may actually be at higher risk of having subsequent injuries. Amputations, there's a number of pieces of farm equipment that cause amputations, but we're not talking about conditions that necessarily are caused by farming, but just conditions that occur as people age. And all these people with any of these conditions and any other conditions that impair somebody's ability to work, are things that Michigan AgrAbility can address. And one thing that people with an impairment, they're more likely, when they're doing the physical labor related to a farm, are more likely to have secondary injuries, which can, make the original impairment even worse. And I gave that example already, but think of somebody who has some visual impairment, which could lead to multiple falls if somebody has to climb a tractor or a silo, or just walk on uneven ground. So, and which then could lead to a secondary injury like a knee injury, which might need to be knee surgery. Again, preventing these secondary injuries would be a benefit of them of getting involved with the Michigan AgrAbility project. So you all should have gotten this brochure, which tells how to contact. These brochures are available. We're happy to send them out, and you could put them in your waiting rooms, because we're interested in getting the word out to the farming community. I mean, ideally, practitioners would tell their patients in their practice who are work on farms of the availability, but this might be something that somebody might see or a spouse might see in the waiting room and could bring home. Again, it is a total free service, and I'll go on a little bit here on what the service is, but it's to help individuals in the farming community to continue to farm. And again, these brochures, one could just download them off of either the Michigan AgrAbility website or off of the Michigan Center for Rural Health website. But if one would like some color or glossy copies to put in the waiting room, please contact me. That my phone number or my email was on that initial slide. It's totally jammed. Oop, there we go. Let me just make sure I didn't skip a slide. It's not there. Okay. It's not responding when I hit the button. Sorry. Okay, there it did. Who can we help? So, people. So I always talk about impairments because you're not disabled. It depends what you do. But actually, the USDA uses the words disability all the time. So really that word should be people with impairments looking for work in agriculture. So I've talked about people already in there, but one of the people groups we're partnering with are veterans groups where you have injured veterans, lost a limb or other impairments from the Middle East and Afghanistan. And there's a whole effort to say, hey, are you interested in entering farming as something to do in the future? And so Michigan AgrAbility will work with people who aren't in agricultural yet, in agriculture, and work with the veterans groups and the individual veteran to help them with their impairment to be able to work in agriculture. So it's not just for farm owners, it's for migrants and seasonal farm workers, farm employees, farm owners, and farm family members. Because many farms, they're not paying salaries to the spouse or the children, but these people are actively working on the farm, and so they potentially can make use of the services also. And so these are just a couple of slides. We're talking all ages. I talked about chronic conditions of aging, but we're talking about people of all size. We're not just men. You can't just think about men. We're talking about women owners as well as spouses. We're talking about both owners and employees. And, you know, we think of farming in the rural setting, but, you know, we have greenhouses and we have more urban types. So we're talking about wherever somebody meets the definition of agriculture. So now the slides are on their own and they're just moving ahead without me, when before they wouldn't seem to move. But here we go. So how does this process work? So the initial step, which, you know, we're clearly able to provide more services, is somebody has to contact the Michigan AgrAbility program. And that can be by phone, that can be by email, but the contact has to be made. And that's where we think it's very important to get these brochures out to people in the medical community. And there's a lot of outreach going on through the Michigan Farm Bureau, Michigan equipment dealers, but also I think it's important that practitioners let their patients know. I mean, they're the ones most familiar with the impairments of their patient, and can say, hey, really, this is something that you could potentially benefit from. You know, you also have this whole issue of farmers themselves being somewhat stoic, so maybe they don't even come to the doctor or the healthcare provider, but if they do, they may not want to take advantage, or not, you know, hey, oh, I don't want to take welfare, I don't want to take this benefit. So it's actually been suggested that maybe practitioners could write on a prescription pad, hey, Michigan AgrAbility program, and the contact information, and say, hey, listen, this is something I want you to do. And same way, maybe, you know, let's say for patients with chronic COPD, chronic obstructive pulmonary disease, we get them into a pulmonary rehab program and make that referral. Maybe we could be doing something similar with the Michigan AgrAbility program. If a farm-related person contacts, then what's called an assistive technology professional will visit the farm and perform a site assessment. So these individuals have a farming background. The key person in the Michigan AgrAbility is a farmer himself, and so he clearly relates to the farming community, and he will go out and perform a site assessment, and I'll say a little bit more about that site assessment. He writes a summary report. He works with the farmer to understand the report. We have a program with the Michigan State University College of Engineering. If we think maybe, hey, there's not really a way to get around this impairment, maybe something new needs to be designed. And so the College of Engineering will work to come up with new designs on overcoming barriers. Now, a thing that has been an issue and will remain an issue, although it's gotten a little better, is funding. So let's say in this report, a whole bunch of recommendations are made, and some of these recommendations, you know, may cost money, you know, put on a new pieces of equipment, change something. So the Michigan Rehabilitative Services provides funds in the to employers to make changes to help increase employment among people with impairments. And they have this past year gotten special money just for the farming community. So generally, if there are items, and some of these are very low cost items, but if there are bigger cost items, the farmer has to put up the money or get money from the Michigan Rehabilitative Services, who still will make the farmer put up some of the money. But there's more money available now for maybe some big ticket items. So, you know, the farmer has an old tractor and it just, you know, can't be changed to make it more user-friendly. You know, this is where the Michigan Rehabilitative Service. But the assistive technology professional has all a lot of good contacts with the Michigan Rehabilitative Service, and we'll work with the farmer to help facilitate that. And then the ATP individual will set up training sessions to help the farmer implement, to help them use if there's new equipment purchased. So here's an example, and this individual has given his permission to use his name. So he's a beef farmer, and he actually has bilateral upper extremity impairments. So at an early age, that third bullet down, he lost half of his left hand in a grain drill year. So he's working on a farm as a child, as many farmers who've grown up on a farm, and so lost part of his left hand. And then at age 17, he's still working on his farm. He lost his right arm entangled in a silage wagon. So here, this fellow's impairment is clearly due to previous injuries. And now, based on, he only has part of his left hand. He's now got the second bullet, he's got a second condition of arthritis in his partial left hand. So this is an ideal person for the ATP person to come out, take a look at, but it doesn't have to be this extreme. It could be somebody who's got some low back problems and just can't lift. But I mean, this person clearly is a person who could potentially benefit from the Michigan AgrAbility program. So, he owns a complete line of older, well-used, now it's moving on its own, well-used farm equipment, which is typically more difficult to operate and maintain. So, and this is not unusual at all. There's a lot of older equipment out there, and the average length of a tractor is 30 to 40 years. I mean, the new ones have more bells and whistles, they're easier, they're more user-friendly, but most farmers have maybe your big corporate businesses have the more newer equipment, but many farmers have older equipment, and they're planning on using it for another 20 years. And so how do you use that equipment? You can see on in the bottom right hand that he's got the prosthesis there, and he's got a glove on his left hand, so you can't see how much of his hand is missing. Many of my chores are labor intensive rather than mechanized. The site assessment, done by the Michigan AgrAbility person, identifies tests and equipment that could be modified or updated, decrease the strain on his left hand, his arm, his shoulder. And so when he's done looking at all of Mike's tasks, he will write this report. And in this report, it talks about what the physical limitation, I'm looking up the upper left, 7, what physical limitations being served, upper extremity, description of what's going to be done, the estimated cost, and vendors. So he makes it as practical. So he's telling to the farmer here, this should make the job easier. It's only going to cost you $10. This is where you buy the thing. If you go down to item 9, which begins at the bottom of the left and heads over to the right, now we're getting to costs that cost $1,600 to $2,000. So here's where the Michigan Rehabilitative Service can come in and help. They'll still make the farmer put up some of the money, but they will provide financial assistance. And so Ned, who is the assistive technology professional, who's the main one, will go through this and look at all the tasks performed by the farmer. So this is very labor intensive on his part, and he'll spend a bit of time on the farm. And so here he is. He's got this wood burner. And, how's he going to get these big logs into the burner? And again, you can see the prosthesis on his right hand, and he's got this glove on his left hand. And so the problem is inability to lift heavy logs. And this actual piece of equipment was designed by the MSU Equipment Engineering Department to help get these big logs in. difficulty opening large doors. So we're talking now the solution-powered shop door opener, which relieves stress. So, these obviously exist. It's just an issue of cost, identifying best way to include it. Difficulty holding tools. And so there are specialty-made hand tools, and it's connecting up the farmer in this case with the manufacturers, the cost, and if depending on how much they cost, potentially helping them get financial support from Michigan Rehabilitative Services. I'm almost at the end here, and I just want to list some of the groups involved. So we got the Easter Seals, Michigan State University Extension, Michigan Farm Bureau, and those are the main players. Michigan Rehabilitation Service is very important for providing financial assistance. And then we have groups we're working with both to get outreach to let the farming community know. And as I mentioned, the veterans, so there is a farmer veteran coalition to help individuals with impairments who are veterans, who are coming back, who are already farmers, but also to help people get into the farming industry, community, and working, and who have impairments. So there's a bunch of groups we are working with to help get the word out and to help individuals with various impairments. So that is the end of the presentation. Again, just to emphasize, this is a free program funded both by the federal government, USDA, and charitable deductions. I think this next slide shows some of the groups who have over many years provided donations to Easter Seal to provide this program, be them Alpha Gamma Rho, the Andersons, K&M, Michigan Sugar, Wild Sales, as well as Michigan Farm Bureau has encouraged its members, Seidel, and so there have been a number of donors. So I'm going to stop there and see if there are any questions.